As the local leaders in reproductive health, Next Biosciences is committed to helping you build your family. One of the ways in which we do this is through our Preimplantation Genetic Testing for Aneuploidy, also known as PGT A. PGT is a genetic test that can be performed on embryos produced through IVF to screen for genetic abnormalities. The road from infertility to meeting a healthy baby can be an emotional one. For you and your partner who have chosen to begin your in vitro fertilization journey, the experience can be filled with both hope and uncertainty. The hope is for a healthy baby. PGT-A is a test that can reduce uncertainty and improve the chances of successful pregnancy. Healthy embryos have 46 chromosomes. A change in the number of chromosomes can lead to a change in development of that embryo. Embryos with the correct number of chromosomes are more likely to lead to a successful pregnancy. Embryos with the incorrect number of chromosomes are unlikely to lead to a successful pregnancy and increase the risk of a miscarriage, or can result in a child being born with a genetic condition. By differentiating between genetically normal embryos and genetically abnormal embryos using PGT-A, your fertility specialist can selectively transfer embryos with the best chance of leading to a successful pregnancy. How does it work? Number 1. Embryos are created through IVF by your fertility clinic. Number 2. A few cells from each embryo are biopsied on the 5th day of growth. The cells from each embryo are tubed separately and sent to Next Biosciences laboratory for testing. The rest of the embryo is frozen and remains at the clinic for future implantation. Number 3. The biopsied cells undergo PGT-A testing. Number 4. PGT-A testing uses state-of-the-art technology for testing of each individual sample. Number 5. The PGT-A result for each embryo will guide your fertility specialist to choose to transfer an embryo with the correct amount of chromosome material, which has a higher chance of achieving a successful pregnancy. PGT-A is available to everyone, but it is often recommended for women above the age of 35, as the chances of embryos with a chromosome abnormality increases with age. Women who have had multiple pregnancy losses or repeated implantation failures during IVF, and cases where severe male infertility has been diagnosed, could increase the chances of chromosome abnormalities in the sperm. By selecting embryos with the correct amount of genetic material for transfer, you are reducing the time between IVF cycles and therefore overall time to a successful pregnancy. You are improving the pregnancy rate per transfer, as well as improving the chances of a successful pregnancy. You are reducing the chance of having a miscarriage, and you are increasing the level of confidence in a single embryo transfer, avoiding the associated risks with multiple birth pregnancies. PGT-A serves to optimize your IVF journey, bringing you closer to the dream of having a baby. By choosing Next Biosciences as your reproductive partner, we can help you go from fertility to family.